You're listening to the Mommy Labor Nurse Podcast, episode number 33. Hey guys, we are doing a birth story this week with Miss Jasmine. She came on to record an episode. It was a while ago that she came on to the podcast to share her story. And this is a story for really anybody, but if you are a preemie mom, or if you know somebody who has had a preemie, or if you have any experience with preemies, this story is for you because Jasmine had a baby at 25 weeks and 2 days of gestation, which is very, very, very early. Most of us know if you're pregnant, hopefully you know that a term pregnancy, once you hit term, once you are 37 weeks, you're considered term. But we count pregnancy up, most people go to 37, 40 weeks of pregnancy. So to have a baby at 25 weeks is very early. So Jasmine came on and shared her story. She was having issues with her pregnancy pretty much from the beginning. She was having UTI, kidney issues, and then her cervix just started to dilate. By the time she was about 24 weeks, her cervix was already 80% effaced, so pretty thin, and her cervix was 1.5 centimeters. She got admitted to the hospital, and she was put on multiple medications like magnesium, given steroid shots for his lungs, morphine for pain, and lots of change in positions. She was able to keep her baby boy in for a little bit longer, but then at 25 weeks into gestation, he had a mind of his own, and he decided that that was the day he was going to be born. There is a lot more to this story, and Jasmine does a wonderful job explaining his whole story and what she went through, and then his NICU stay. So without further ado, let's hear Jasmine's story.
You're listening to the Mommy Labor Nurse Podcast, where we firmly believe in the power of education when it comes to giving birth. Tune in each week as we dive into pregnancy-related topics, expert interviews, and a variety of birth stories. As a reminder, anything you hear on this podcast is not medical advice. Please see mommylabornurse.com/disclaimer for more details. And now, here's your host, educator, registered nurse, and fellow mom, Liesl Teen.
This episode of the Mommy Labor Nurse Podcast was brought to you by BetterHelp. Is there something interfering with your happiness or is preventing you from achieving your goals? I personally have tried BetterHelp.com in the past. Right after Walter was born, I was really struggling with some stuff and I needed a counselor, but I didn't really want to go out of the house because I had a newborn. So I signed up for BetterHelp, and it was just so wonderful to be able to text with my counselor back and forth and talking to her about the issues that I was going through. One of my favorite parts of virtual therapy is that you do have the ability to do that, and you can just kind of scroll back through your conversation and refresh your memory instead of typical counseling where you kind of have to rack your brain and think, oh, what exactly did she recommend to me? With BetterHelp, you have access to that whole conversation. You can just scroll right back through. BetterHelp will assess your needs and match you with your own licensed professional therapist. You can start communicating in under 24 hours. It's not a crisis line. It's not self-help. It is professional counseling done securely online. You'll get timely and thoughtful responses. Plus, you can schedule weekly video or phone sessions so you won't ever have to sit in an uncomfortable waiting room as with traditional therapy. It's definitely way more affordable than traditional offline counseling, and financial aid is also available. BetterHelp wants you to start living a happier life today. Visit their website at trybetterhelp.com/labornurse. That's trybetterhelp, and join the over 500,000 people taking charge of their mental health with the help of an experienced professional. Special offer for Mommy Labor Nurse listeners to get 10% off your first month at trybetterhelp.com/labornurse. And now let's get into today's episode. Hi, Jasmine. Welcome to the Mommy Labor Nurse Podcast. Thank you so much for being here today.
Hi. Yes, thank you so much for having me. I'm so excited.
Yeah. Can you just start by telling our listeners a little bit about yourself and your family and where you're from, what you do, all that good stuff?
Sure. So, of course, my name is Jasmine Hill. I'm originally from Brooklyn, New York. I moved here. I'm in Georgia now. About 45 minutes from Atlanta. It's
Cool.
called Ackworth. Yeah, it's a little city.
Cool.
Suburbs. Yeah. But I moved here when I was 12. So I've been here for a long time, pretty
Yeah.
much. Yeah. I met my husband when I was, how old was I? 21 or so. Yeah, so a long story short, we got married, and when I married him, I told him I'm not sure I can have children because I do have stage 4 endometriosis. So I didn't even
Oh.
think it'd be possible to have kids. The doctor told me it was like a 0.0110 or something like that % chance.
Oh
So
gosh.
yeah, that's something that really was not in our plans because we just didn't think that was possible. But now, yeah, it's very possible. I
Yeah.
see.
With a baby laying
But,
next to you, right?
exactly, right. One in my belly. So yeah.
Awesome. Awesome. Cool, cool. Well, guys, today we are doing a birth story, and we're going to be talking about Jasmine's first birth of her. You had a boy, right? I can't
Yes.
remember now. Yeah, of your son. So if you want to kind of go back, I know you talked a little bit about your issues, maybe with fertility, with those medical issues, but if you want to go back to kind of when you were finding out you were pregnant, and if you had any, losses or anything before this pregnancy, just kind of take us back there.
Yeah, definitely. So the first time when we got married in 2016. So I think in September of that year, I was feeling kind of sick then, and I went ahead and took a pregnancy test, and I found out it was positive. Shockingly, scared out my life.
Yeah, I'm sure.
Yeah, because we just got married. But then a few days later, when I retested, it was negative. So I was like,
Oh,
"What in the world?" So I called my OB, and I eventually went, and so that's what they said. Then I was taking something called a Depo-Provera, which is like
hmm
a shot, which is supposed to help with my endometriosis, but they said sometimes that's very common to happen in chemical pregnancy when you're taking that medication. So unfortunately, yeah, that happened the
oh,
first time. Yeah, but then so it's funny how we found out the second time. So the second time, I had a point in my life where I was like, oh, I want to have kids. I really wish I could have kids. And,
hmm
we didn't necessarily try. It's just like we were like, if it happened, it happened. But I didn't think it could anyway. So I was like, well, let's do some other things, do some volunteer work. So we were actually booked a flight to go to Ecuador to
Oh,
volunteer.
wow.
Yeah, to volunteer there. And I think it was like a couple of, I don't know if it was a couple of months. I think it was a couple of months before we had actually decided to go or whatever. But my husband for some reason was like, you need to take a pregnancy test. And I was
hmm
like, why do I need to take a pregnancy test? I'm not pregnant. Like, I know I'm not pregnant. I'm fine. I'm not sick. Nothing's wrong. I don't even think I could get pregnant again. So I
Uh-huh.
don't know. So I went ahead, and I listened to him. I took the test. And so the first time I took it, I think it was like I did it wrong or something because it
hmm
went completely white. There was no,
Oh,
yeah. So I was like, like, well, I'll take it again tomorrow. It's probably going to be negative. So I don't have nothing to worry about.
yeah.
So then, yeah, he reminded me to take it the next day because I forgot. So I went ahead and I took it. I left it on the counter, just like, this is dumb. I don't see why I have to take this. Lo and behold, it was positive. And I was like, oh my gosh, like, are you serious? This is insane. I don't believe this is not happening to me right now. I'm freaking out. I'm like,
Yeah.
we have a trip to Ecuador. Are you kidding me? I was really upset at
Oh, I'm
first.
sure with like a trip planned and everything, like I can relate to that. Like I can understand that, like getting ready to go on a trip and you just found out you're pregnant. Like,
I
geez.
know. Exactly. We used to like put out money for this trip. So it was like
Yeah.
but after about a couple of weeks or two, once we confirmed it, yes, it was true. I was indeed pregnant this time for sure.
Yeah.
I kind of calmed down a little bit. I think I was excited, but I think I was very anxious
Yeah.
because I do have endometriosis and I don't know, what that would do in my pregnancy, if I would have
Yeah.
any complications, if I would lose the baby. I mean, it was so many things going through my
Yeah.
mind. I didn't know exactly what to expect. It's my first pregnancy. Technically, I guess pregnancy that continued, so I didn't know what to expect, what to do.
Right. Right.
So that's what I found out initially.
Yeah. Cool. Well, so with your first trimester, did you have like a lot of morning sickness, a lot of issues, any bleeding, anything like that?
In my first trimester with that pregnancy, and I think it started about 6 weeks. I did have some morning sickness. I didn't throw up though. I
Yeah.
just got really, like nauseous and, just felt really sick. It's not good, how that feels. It's just yucky.
Yeah. You just feel gross and you just feel tired all
Right.
the time. And like, that's
Exactly.
how I felt with Walter. I really didn't throw up a whole lot, but I just kind of felt crummy like all the time.
Right.
It just a crappy feeling.
Exactly. That's exactly how I felt. I just felt really ill and just like you had the stomach flu or
Yeah.
something like that.
Yes.
So that's about it. I mean, there's some weird things I experienced. Like I think I had some tingling in my legs or something.
Oh, huh.
Weird. The doctor said it was normal, so I was like, oh, okay. But nothing else that I can think of. I think more
Yeah.
so anxiety.
Yeah. Yes. No, I'm sure. I mean, especially, I remember how anxious I was in the first trimester, not even having any losses before that. And just because you can't feel your baby kick or move, the
Yeah,
only thing that's telling you that you're pregnant is a pregnancy test, before you get to that first appointment, especially you're like, am I pregnant? I mean, I'm not getting my
exactly.
period, but like, is there really something in there?
Exactly. And that's one thing I did. I was crazy. My friends say I'm crazy. I took 9 pregnancy tests
Oh,
because I
girl,
couldn't
don't
believe
even. That's exactly me. We could be twins because I did the same
wow.
thing.
I couldn't believe it. And I think went to the doctor. I had like several ultrasounds because at
Yeah.
first, the first one was, of course, just a little sac.
Yeah.
And there was no fetal pole or anything in it, just the
Right.
yolk sac and, the gestational sac. But then I think I went a couple weeks later and then we did see the fetal pole and the heartbeat. And once I saw that, I was, oh my gosh, that's powerful to me,
Yeah.
like there's a life growing inside of me. And it was
Yeah.
yeah.
Yeah, for sure. All right. Well, let's move on to the second trimester. I know we can't move on to too much to the third trimester,
No.
but we can talk about the second trimester and how your second trimester went up until the end of it.
Okay, yes, definitely. So the second trimester, that's when actually no, I should have said so 10 weeks is when I started having issues.
Uh-huh.
So I was having like urinary tract symptoms,
Mm-hmm.
like an infection. I did have that often when I wasn't pregnant, and I did have a kidney infection twice.
Oh,
So
yeah.
yeah, it felt that way like I was having a kidney infection or something. So I would constantly go to the doctor. They would, do cultures.
Oh,
But every time they did it, it was negative. There was no bacteria. Everything was clean. There was nothing found. But I'm like, look, there's something wrong. I don't know what's wrong. I don't feel right. And I kept
yeah.
trying to voice that. But because there was nothing to be found, it's little, they couldn't do so much. But they gave me ultrasounds for my kidneys, nothing. I think I went to a urologist, nothing. So it was just very weird. Yeah, we to this day we don't know what I was feeling.
Huh.
And then some doctors were like, "Oh, it's just pregnancy related." So I guess at some point I just gave up.
Mm-hmm.
And was like, you know what? I guess that's what it is, and I'll just do what I can do, and
Yeah.
that was that. So moving toward the 22nd week, because I was hospitalized like several times. I think about 4
Mm-hmm.
that whole pregnancy. But 22 weeks, so I went to which doctor was that? The hospital, and I was complaining of the same thing, urinary tract symptoms and all of that. So
Mm-hmm.
this doctor, they wanted to do a cervical exam, and so I didn't know really much anything about cervical exams as far as like checking your cervix to see if you're dilated. So he went ahead and he checked it, and oh my goodness, it hurt so bad
Yeah.
the first time. So when he went in, he was asking me, he said, do you have you given birth before? And I was like, no. And he was like, have you had any other prior pregnancies? And I did tell him about the chemical, but he was
Yeah.
like, well, that wouldn't really do anything.
Right.
And so I was like, well, why do you ask? And he was like, because you're a centimeter dilated. And I was like, what? That doesn't make any sense. I don't understand why that would be. I'm trying to do everything cautiously. I haven't, done anything crazy or anything. So I don't,
Right.
understand why that would happen. So anyway, he was like, well, sometimes that happens and women can walk around 1 centimeter until they give birth. So I'm like, oh, okay, well, I don't want to do anything to make it worse. So I went home, and I think from that point, I was pretty much trying to be on bed rest just so to preserve my cervix,
Yeah.
keep me inside. So it did work for 2 weeks or so. And by 24 weeks, I lost my mucus plug. And so I was freaking out, panicking. And at first, I didn't think that's what it was. So I wasn't really concerned, too much about it. But then I was like, wait a minute, I think that's what it really was. So I said, you know what? I asked my husband, can you just take me to the hospital just so we can see or, see if anything else is happening? So I went to the hospital again, and the doctor, she said, oh, well, it doesn't seem like you're dilated anymore. So we were like, okay, great. So I went back home, and actually that same day, I was having a gender reveal party. And so, I was trying to put everything aside about, being, I guess, anxious or having anxiety about that. So I put that aside, and then I didn't know what we were having. I wanted a boy, but when I found out, because we did it at our house in the backyard, I found out, and the blue smoke came up. I was so excited. I started jumping up and down.
That's so cool.
Yeah. But it probably made things worse.
Oh.
But after that, I think it was the day after, I felt kind of weird. I felt pressure like down in my vagina. So I was like, I think I might need to go see a doctor again. So my husband said, okay, that's fine. Let's go to see the OB. So I went into the OB's office. Oh, and then I felt a trickle, like some trickling down my leg. And I'm like, I don't know if my water broke or what's going on. So we went in just to be sure. And then the doctor, she did I think it's the fetal neck. I don't know the names. I know you know.
Fetal fibronectin is probably what she did.
Yeah, exactly. She did that, and it came back. It was negative. It wasn't amniotic fluid. So it's like, oh, thank God, it's not that. So she was like, you know what? But I still, would suggest you probably be seen at the hospital. And I was frustrated at the time. I was like, you know what? I keep going to the hospital. They're not really doing anything about it. So, I mean, what is there for me to do? And so I said, you know what? Can I see a maternal fetal specialist? Because while I was at the hospital, they always referred me to them anyway. So I was like, can I just go straight to them instead? And so she was like, well, I don't know what that's going to do, but, if that's your choice, sure, we'll go ahead and do that. And I thank God to this day I did. But she went ahead, scheduled me an appointment. We went in that same day. I told her what, the doctor there, what I was experiencing and all of that. And she said, well, let's do a cervical length exam. So we're like, okay, that's fine. So she went ahead, she did that. And when she did that, my cervix measured 1.5 centimeters. Exactly. So I didn't know what that meant. Yeah. But she was like, she sat us down. She's like, I think you need to go to the hospital, like for a length of time until the baby comes, pretty much. We were like, wait, what?
Yeah.
I have to stay where? So I was, frustrated about that too. And then me and myself, I was being very hard-headed. There was a hospital called Northside Atlanta, and it's the best hospital for like NICU. It's actually one of the best in the state of Georgia.
Cool.
And she was suggesting me to go there, and I was like, no, I don't want to go there. It's too far from my house. I want to go to Canton. I'm gonna go to Canton Hospital, and that's what I'm gonna do. So my husband, he was like, are you sure? I'm like, yes. I don't want, if I have to stay, that hospital is nicer, because this one is like in the city, and so it's the main hospital, and it's not as nice. So I was like, I'm going to the other one. It's newer, and this and that. So
I've already planned on going to this one. I'm going to my own hospital.
Exactly. Like, that's the one we wanted to give birth in. So we were like, oh, I'm gonna give birth. I'm gonna give birth here. But unfortunately, the hospital didn't have a level 3 NICU, just in case, he was born. So I packed my bags. I got there. I saw a doctor. I was explaining what was happening. So he did a cervical exam. At that point, I was 2 centimeters dilated. So he was like, unfortunately, we don't have the proper equipment here. We don't know if you're going to give birth today. tomorrow or in 2 weeks. So,
Yeah.
to be safe, we're going to have to transfer you from the hospital here all the way to the one in Atlanta. And I was like, are you serious? I was
Like, man, I could have just gone myself, I guess.
exactly.
Oh,
So I was like, okay. I just took it as, God's telling me just go. I wanted you
yeah.
to go here. You're being hard at it.
Yeah.
So
Oh, gosh.
I'm going to make you go here now. So they transported me from ambulance to that hospital. And I think by that point, I was like 70% effaced or something. I didn't know what these words meant at the time. Now
Yeah.
I do.
Yeah.
Yeah, it was pretty bad. So I went to the Atlanta hospital, and I mean, I was very wrong. It was very nice. Everybody was, the staff, lovely.
Oh, good.
Everybody, I had an awesome experience there. And so I was there for 6 days, I believe. So when I first got there, the first thing they did, I think at the hospital in the Canton, the one that I wanted to give birth, they gave me a steroid shot. That was the first thing that they had. I got to the one in Atlanta, and they started me on the magnesium. Man, and that that stuff is just awful.
Yeah,
It
could
makes
have
you
a
feel
whole
so
episode
bad.
on magnesium and how bad it is.
Oh my God. Yes, yes. It makes you feel like you have the flu. Like I don't
Yeah.
know another way to describe it. It's just
That's a
really bad.
perfect, that's a perfect explanation of how it makes you feel. And that's what I tell
Yeah.
patients, that, hey, you're going to feel really, really crummy. Like you have the
Yep.
flu or you can't move, and you're just, because it makes you so tired. It makes you so hot and flushed. And yeah, it's just not fun.
Exactly. Yeah, it really does. And I thought they were exaggerating, but I was like, no, they're not.
Yeah. Yeah.
So I had that, and they wanted me on that for 24 hours. So they gave
Yeah.
me like I don't know what it's called, a booster dose or a loading dose initially.
Of magnesium.
Yes. I
Yeah.
guess
So a loading dose. So they give, usually with, when we have magnesium patients, you'll give kind of what's called a loading dose initially in the first, usually about the first 30 minutes, and you give like a whole lot at once to kind of, quote unquote, load you up, with a loading dose. So you get a whole lot into your system at once, and then, you're on a maintenance for 24 hours or 12 hours or however long, the provider wants you to be on.
Right. And that's
Yeah.
exactly what happened. They
And
did
that loading
that, and
dose
then I think,
it makes you feel like crap. Like that loading dose is no fun.
oh my gosh. No, it's horrible. You
Yeah.
hot, and it's just so many different things.
Yeah.
But I took that for, I think, 24 hours. I was on it. Horrible. And I had one of my friends in town because she was visiting for the gender reveal. So we're all cramped in this hospital room.
Yeah.
Me, my husband, and my two friends. And so we're all in there, and they're worried. And they were being, trying to make me laugh and take pictures. So I still have those pictures. But yeah, so we were in there for, I think, that room for about a day. Then the doctor came, and then they decided, okay, we're going to move you to the high risk unit because you're probably going to be here for a length of time, considering, the situation, your circumstance. So I was like, okay, yeah, I figured that, that's fine. Whatever you got to do, however long I have to stay, I just want my baby to be safe. So they switched me to a room the next day, and that's the room I pretty much was in until I gave birth. Well, yeah, right before I gave birth. And so they just pretty much kept me on the magnesium. I did have contractions on and off, but because I do have endometriosis, it was hard for me to distinguish if it was just, pregnancy. I don't know. It's when it comes to pain, my pain is like I could tolerate it. So it's like I don't really notice it sometimes.
Right.
So I was having contractions, but I didn't know it. And they were like, oh, did you feel that one? And I was like, no, I don't know what you're talking about. And then eventually I did start to feel it because it did kind of increase. They were just monitoring me. And of course, my son, Miguel, he was just moving all around and would not cooperate. And they would have to come in every 2 hours to, move the little, I don't know, the monitor. So that was no fun. I'm sure he didn't like it. And he didn't like the mag too because it made him really drowsy. Like his heart rate would go down when you. But they said that was okay. So I was like, okay. So then one night, I think it was on the 5th day that I was there, the mag was not working because I took mag for about 4 days on and off. They gave it to me. the 5th day, they said, okay, that's it. We gave you enough. We don't want to give you too much. So I said, okay, that's fine. Look, I don't want it anyway, but, I want to do what I have to for my son. So I said, okay. So I was cramping, and I felt it was strong. I didn't know it was contractions at the time, but it was. So I started to contract about 8 o'clock that night.
Mm-hmm.
And I did have a doctor initially that was on call, and he was like, I think he did a cervical exam, and he was like, no, I don't see anything wrong as far as, you dilating anymore. It just seems the same.
Mm-hmm.
So, we should be okay for, however long. So I'm like, okay, well, I guess I've been hearing that all the time, so that's fine.
Right.
So then the pain started to increase, and I was like, okay. I told the nurse, and she told me to move on my side. It wasn't working. And it started to get to the point where it was affecting my breathing. And I was like, wait a minute, something's wrong here. This is not right. I've never experienced this. So then I, just dealt with it. And then I started bleeding. So I was getting afraid because I was like, I didn't know what was happening. Am I losing my baby? I don't know what's happening. So I'm frantic. My husband's frantic. So he got the nurse, and she called the doctor. The doctor came back, did another cervical exam, and was like, no, I don't see any changes here. I said, well, why am I bleeding then? Mm-hmm. And so he was like, oh, just cervical change. I'm like, if you just said there's no change, and now you're telling me anyway. That's a whole nother story.
Yeah.
But so what he initially said, I think he gave me some morphine or something for the pain. But nothing was working. Like, the morphine put me to sleep, but the contractions would keep coming, and I would wake right back up. So, that went on for about 12 hours or so. And then he was like, okay, we'll just leave her till the morning doctor. And I'm thankfully did, because that's actually the doctor I wanted to deliver me in the first place. So
good.
She came in the room, very sweet doctor. She came in the room. She was like, oh, because I had saw her a couple days prior. And she was, explaining to me what could be going on. So they went ahead, did an ultrasound. They saw the baby was head down. So I think after that point, she did another cervical exam. I was still bleeding. And she said, oh, yeah, you're going to have a baby today. And I was like, wait, what? I was only 25 weeks and 2 days. So I'm frightened. I'm like, I don't know what's going to happen. I've been reading stories about premature babies and different things. And the neonatal team had come down and pretty much explained to me what would happen if I had a baby this early, what the survival rate is, and all of those things. Certain things you don't want to hear, certain things you have to hear, but we just listened and just said prayers, and there's nothing else we could do at that point. So we went ahead excuse me, we went ahead and she said, okay, well, we're going to go ahead and send you to a delivery room. So I don't know what's going on. I'm in pain. That's all I know. I'm just in pain, and I'm laboring. And I finally got to the room, which I was like halfway there. I don't know what was going on. I just remembered a few things vaguely. The doctor did ask me that I want an epidural. I was like, yes. Because initially,
sign me up.
I was not prepared. I mean, if I was like prepared for a natural birth, and it may have been different, but there was no preparation, like whatsoever. It was just told, oh, you're having a baby. And that's that.
Right.
So I went ahead, and she gave me the anesthesiologist. She came, and I don't remember it, but my husband said, yeah, she came, and she was, in your back, and she put the needle or the catheter in your back. And it was really quick, because I just remember having pain, and then all of a sudden I didn't have any more pain.
That's good. That's a good epidural.
Yeah, it worked fast.
That's good.
Yeah, so my my legs, everything was numb. I couldn't feel anything, and from that I was able to go to sleep, because I hadn't slept that whole night. So I was able to sleep finally. And I guess as that's happening, my husband had alerted my family and his family that I was in labor. So I would hear people, but I couldn't respond. It was very strange, but I couldn't really respond. Then I started shaking really bad. And they told me it was from the epidural. So I was like, oh, okay, well, I guess that's what that is. So about 2 hours later, my husband told me that's how long it was. The doctor came back in, and she checked, and she said, okay, you're crowning. And so I was like, okay, well, I don't know what that means. So she said, oh, that means the baby head, I can see it. It's coming out. I was like, really? So she said, yeah, it's time to have the baby. And so she explained to me, she talked to me a little bit first, and she did tell me, the baby's gonna be very small because he's only 25 weeks, and but we're gonna have a midwife here. We're gonna have a team of we're gonna have a neonatologist and some neonatal nurses.
Yeah.
They're all gonna be here. They're gonna be over there, and once the baby comes out, we're gonna let you see him and then give him to them. That way, he can get taken care of and everything. So it's not gonna be like a normal birth. So I was like, whatever you have to do to keep my baby alive, that's what I want,
Yeah.
Yeah, do anything. Yes, exactly. I totally get it. So she went ahead, and so I put my foot in the stirrups and everything, and literally, and within 2 pushes, he was out. Yeah. That was it. He was only 1 pound 10 ounces, so he was very, very small. Aww. When he came out, though, I was shocked to see, because they said he was so little, but he looked bigger than what I thought he would look like. I guess from the pictures I've seen. So I was like shocked. So when he came out, this little boy came out crying, and I was like, "Wait, what? How are you?" Him. I know. Like,
they do that sometimes, man. Those little preemies, when they're ready to come out, they're like, "Hey, I'm out, and I'm gonna cry, and I'm gonna make a fuss about it." Everybody's like, "Whoa!"
I know. And I guess from that cry, it just kind of touched my heart, and I just started crying. I'm like, he's alive,
Yeah.
Hey. And actually, I know the doctor said, well, that doesn't really matter as far as like the what is it? The
Apgar. Yeah.
Because that's for term babies. But his score at first, the first minute of life, it was an 8. And like 5 minutes into life, it was a 9.
Hey.
Oh, yeah. He was doing well. And my husband, he was in such a daze. He was looking like, I don't know what to do.
Yeah.
I'm like, just go there, take care of baby, take pictures. I can't see what's going on. So he was taking pictures, and he was touched too. So he cried a little too. Aww. And so we were all. I was just happy he was alive, and so he went.
Of course.
Them and, because that was scary. But he went with them to the NICU, and he saw. I think my son was on CPAP at first. And of course, he's 25 weeks, so his lung is not fully developed. So yeah, he had problems breathing at first, and eventually, I think the same day they had to intubate him. But I was just again happy he was alive.
He was here, and he was okay. Yeah, exactly. No, that's so great. Well, I did want to ask you. I want to ask you about his NICU stay, and I want to also, before we talk about that, I want to ask you about your postpartum experience first and how kind of that was after having a 25-weeker.
Okay, so yeah, when I initially when everything happened, I was just happy he was alive and everything. And they said I didn't have any tearing, which I wouldn't expect to, considering he's so small.
It's pretty small, yeah. Sometimes you still can, but yeah, usually those preemies, they just you don't have very much tearing.
Yeah, she said it was like some scratches, but that was but no stitches, thank goodness. And so I couldn't have been my legs, so they helped me to go to the bathroom and everything. And then of course I bled. That was the whole nother thing. But I think after that I went to the recovery room, and I think I had to stay there for like an hour or two just to be monitored. Then they had to push my stomach down and help me to, I don't know what it's called, but when they come and push your belly down after you give birth.
A fundal rub. That's what they're called. But they're just checking. Though. Yeah, they're not fun. They are not fun. They're not called fundal rubs because it's fun. But no, it's just a check to make sure that your uterus is in the right place and that you're not bleeding excessively, and to make sure that it's kind of cramping down as usual. Now, when somebody's 25 week, delivering preterm, especially that preterm, it's a lot more difficult because your uterus isn't that big. Because with a term patient, it gets a whole lot bigger, and it still shrinks down. But yeah, with a 25 weeker, you can still do a fundal rub, of course, but it's just kind of a little bit harder because it's a little smaller in there.
Oh, I didn't know that.
Yeah.
Oh,
yeah.
Wow. Well, that makes sense now.
Yeah. Yeah,
But
still not fun. Still not
right,
fun.
no
And,
fun, no fun at all.
but
People
yeah.
asking, they're like, oh, so I'm sure your labor wasn't that bad. I'm like, look, I know my baby
No.
came at 25 weeks, but 10 centimeters is 10 centimeters. I don't care who you
Uh-huh.
are.
Uh-huh.
Yeah,
Yeah,
and
and
that's it.
sometimes you know, and usually what a lot of times what we see with preemies too is like it goes so incredibly fast and you push so fast because those
Yeah,
preemies when they're ready to come out, they're just ready to come out. And
right.
yeah, no, you're exactly right. It's not as your baby isn't as big as a term baby, but the whole labor experience is the same. The pushing is the same. Everything is the same.
Yeah, yeah. That was a very traumatic experience, I would
Yeah.
say. And I guess that's why I'm so afraid now. But anyway,
Yeah, I know.
so
I'm sure. I'm sure.
yeah. Whew. But after I stayed in there and they, did the fundal rubs, they said I can go see my baby. And I was at that point I started getting nervous because I was
Mhm.
like, what's going on with him? I don't know. I can't see him. My husband,
Yeah.
he's not really answering the phone. So I'm like, okay, what's happening? I need to know, what's
Right.
going on. So he finally came back in and then we had friends there. So no, and I told him, I said, I don't want nobody, seeing him at first before I see him.
Yeah.
It's my
He's my
so
baby.
yes. So my husband, he's like, yeah, definitely. No, nobody's gonna go there. So he came and he got me in the wheelchair and we rolled down there. And I promise you, like when I got in the NICU, I mean, you see all the other babies and they look, they're pretty much a lot of them were term. They
Yeah.
would just had some issue or something, but
Yeah.
they were normal size. So I was looking, but my baby, he was all the way like toward the end in the back.
Mhm.
So I'm looking at all these other babies as I'm going through, and then I go to our pod, and then I saw him. And I guess after seeing a regular term baby and then
Mhm.
seeing my little 1 pound, 10-ounce baby,
Aw.
that was just crushing. Like, I'm trying not to get emotional now thinking about it, but it's just like,
Yeah.
it was, I guess, heartbreaking, but at the same time, it was like, I was happy he was here, but I hated the fact that he had all those tubes and everything inside of
Of
it.
course.
It was awful to
Yeah,
see.
of course. And it's probably like you walk past all these term babies and then you look at your tiny little baby and you're like, oh my
Uh,
gosh, my baby has to grow to that size and it
exactly.
seems so far away.
It really did.
Yeah.
I'm telling you, that's the honest truth. It really did, and it was like he's never gonna get that big.
Yeah.
So I always have a lot of questions to ask doctors and everything. So I was
Yeah.
asking. I think I met the doctor, and she was pretty much telling me how he was doing and what to expect. I mean, there was so many different terms. I'm
Yeah.
like apnea, bradycardia,
Mhm.
different things. Like he had lung disease at the time.
Yeah.
He had, because his lungs was not fully developed. So a lot of things that he went through is because, of course, he was not supposed to be out of the womb so
Right.
early. So he, of course, was gonna need a lot of. He was in intensive care, so he was gonna need a lot of care
Yeah.
and different things, to help him through his stay.
Overall, how long did he stay there?
Okay, so he was there for a total of 108 days.
Okay. So that's a while. That's, 3.5 months-ish, almost
Oh
four
yeah,
months. Yeah.
it seemed forever.
Yeah. And that's pretty normal, guys. Like I mean, let me think. How many weeks? I don't even know how many weeks that is, but they usually tell you when you have a preterm baby, whatever week it is, that, hey, expect this baby to be here in the NICU until their due date. And that's
Yeah.
probably that's probably what they told you. So,
Yep.
and that seems like it kind of lined up that he kind of went home around his due date.
He did. He went home exactly what, 4 days later, I think,
Yeah.
when his due date was. Yeah,
Yeah.
because his issues, and I thank God, but his issues that he had were basically, respiratory. He
Hmm.
had to be on several different, like the worst was like the oscillator, the
Yeah.
ventilator,
Oh,
CPAP, high flow, all of those pretty much
yeah.
so he could go home. And then he had some abdominal issues also.
Hmm.
But that he never had neck or anything. That he was fine. It just caught things in time. He had a few
Yeah.
infections, but thanks to God, he when he got out the hospital, he didn't have a lot of he didn't have anything as far as like chronic issues due to his prematurity. He had what is it called?
RSV?
Retinopathy.
Oh.
Retinopathy of prematurity with the eyes. But he had stage 1, so it cleared. Like
okay, that's good. Yeah, that was going to be my next question, is that does he have any like chronic illnesses as a result?
No, surprisingly he doesn't.
That's great.
He doesn't follow up with a pulmonologist. So he just goes for his normal visit, and he just had one yesterday actually. He's doing great. They said he's 20 pounds now, 9 months.
That's great. That's so great. So I guess how long has he been home now if he was in the NICU for 4 months? So you've had him home for like 5-ish months now?
Yes, 6.
Something like that.
Almost
6.
Yeah.
6.
Almost.
Awesome.
Yeah.
Awesome. Cool. Well, I did want to quickly ask you too. I always touch on like breastfeeding experiences, pumping experiences with people. And did you try to pump for him at all, or what was your experience with that?
So when we the whole thing, when we first got into the NICU, the doctor did explain to us, the importance of breast milk. And I wanted to breastfeed anyway, but it just didn't work out the way I wanted it to. So I guess in my head, that was like a strong determination I had. Like, I have to produce milk, because I think the first couple of days of his life, my milk hadn't come in. I had, little drops of colostrum, but it wasn't so much. So I guess in my head, I was determined to keep pumping so I can give him milk, because he had donor milk for the first couple of days. So, I mean, thank goodness about 3 days, 2 or 3 days in, my milk came, and it was, pretty good at first. And so I guess I became obsessive with pumping.
Mm-hmm.
And I think by the 3rd week or the 4th week, I was pumping 60 ounces a day of milk.
Wow.
Yeah, it was a lot. Yeah, because
you were super obsessive.
Yeah, I was like, patient would come and tell me, yeah, you may need to slow it down, because he's not going to do that. But that was like later on, they was telling me that, because it became so much milk that the I guess, I don't know, whoever prepares the milk lactation or whoever prepares the milk, they were like, we need to send some of your milk home, because we don't have any room.
We didn't send it back.
I was happy to be able to do that, because all he got was my breast milk. So
that's great.
Yeah, that was great. And then by the time he got to 34 or 35 weeks, he was on a lower form of respiratory support, so he was able to try to breastfeed. And the first time, it didn't go as well as I expected it to go, but he did latch on for a little while, and then he let go. But the stronger he got and the older he got, he would latch on. And then I think by 39 weeks, he was breastfeeding. So I breastfed him for about 3 months before I became pregnant again.
Yeah.
And then I had to stop. But he still has breast milk to this day. He'll probably have breast milk for the next 5 months.
Yeah. Are you producing still at all, even though being pregnant?
No, I was, but they told me at 12 weeks that they wanted me to stop, because they said that it, makes you contract, and I didn't need that, especially with your history.
Yeah, that's a very good point, because that's a common question that I feel like I hear all the time, that people are saying, can I still breastfeed? Like, with my, now that I'm pregnant again, I have a however month-old, a 6-month-old or 10-month-old or whatever, and I'm still breastfeeding. Is it still safe? And the answer usually is yes, unless you have contraindications and, you've had high-risk pregnancies, ask your doctor. And in your case, yes, absolutely. I can understand that your doctor's like, hey, you had a 25-weeker. We want to try and not make that uterus contract at all.
Exactly.
So,
exactly.
Yeah, that makes a lot of sense. Well, cool. Well, awesome. Well, thank you so much, Jasmine, for sharing all of that. That was a miraculous story. I can't believe all of that you went through. That's so crazy at 25 weeks to have a baby like that, and then that long NICU stay. I'm sure you are just so happy to be home with him now, and I'm sure I think you referenced it, that you're anxious about this pregnancy, which I can completely understand.
Yeah, I'm 24 weeks now, and that's when I was explaining everything pretty much was happening at 24 weeks, and then he was born. So I'm
so you're right at that time.
Yeah, exactly.
Yeah. Now, are they? I was going to ask you, are they doing anything in this pregnancy different like to maybe prevent any complications from happening? Like, are you getting progesterone or anything like that?
Yes. So this pregnancy, well, for one, at 16 weeks, I started taking the progesterone shot, and I have worked it out where the nurse comes to my house and she's able to give it to
Nice.
me because they don't want me to. They pretty much put me on. First, they put me on pelvic rest because I had a placenta previa,
Mm-hmm.
but thank goodness it's moving away now, so it's not hopefully going to be there by the time I
Mm-hmm.
deliver.
Mm-hmm.
But they wanted me on pelvic rest, but now they're just saying, if you're for it's been helping the pelvic rest, so just pretty much stay in the bed when you can. We do understand you have a 9-month-old, so
Mm-hmm.
whenever you can, try to be home, try to rest, don't go to any places. That's what I've pretty much been doing, just
Yeah.
resting and the shots and praying. And that's
Yeah.
about it.
That's all, and sometimes that's all you can do. And another option and it's kind of case by case, but sometimes when you have a situation like that where you just kind of go into preterm labor and they don't really, know the exact reason, it's not because of infection, it's not because of this or whatever, they'll talk about a cerclage, putting a cerclage in. And I don't know if that option was ever presented to you. Did they ever
So
talk to you about a cerclage?
I asked him that earlier on, and the doctor, I love him, he's great.
Yeah.
Asked him about a cerclage because I was reading. I had friends who had incompetent cervix, so that's
Yeah.
pretty much what he explained to me the reason it would be for. But they
Yeah.
said because I was contracting with and it wasn't an incompetent cervix. We don't know why he came.
Yeah.
He just did. But if you had an incompetent cervix, it would be, you wouldn't feel anything. You wouldn't even be contracting. It just, your cervix just opens for
Right.
whatever reason it does. But no, I was contracting and everything else. So
Yeah.
he was saying, I think that would be a good idea because if you were to go into preterm labor again, you could still contract and tear, and that
Right.
would be even worse.
Right.
So they
Right.
said no.
Exactly.
They said if my cervix would shorten, on a weekly basis, because they do see me. I do go to maternal fetal specialist every
Yeah.
2 weeks. They check the cervix, and thank goodness yesterday I went and it's still 4 centimeters. So
Woohoo. Yeah. And I was going to bring that up when you were talking about earlier that it was 1.5 centimeters. I wanted to bring that up to people who are listening who are confused about that. But the 4 centimeters is, so when you talk about a cervical length, and they're usually measuring, it's like a vaginal ultrasound. And so they put the probe up there and they say, okay, looks like your cervix, they're not measuring how dilated you are necessarily with that wand. They're just measuring the length from like how basically the effacement and how kind of thick the cervix is.
right.
And 4 centimeters is a nice long, thick cervix. So by you being 1.5 centimeters at 24 weeks or whenever that was that you talked about, 20, did you say 22 or 24 weeks when they saw
24.
that? 24.
Yeah.
Yeah. So, at 1.5 centimeters, that's a pretty significant, shortage. So,
Oh yeah. So when they told me that yesterday, I was like, oh man, I'm so happy because I've been contracting, but it hasn't been consistent. So I was
yeah.
just concerned about that. But
Yeah,
so far
that's
so
good.
good.
Well, prayers to you. big, big
So
thoughts,
much.
big prayers to you that, this pregnancy goes smoothly. I think you're doing all the right things, by resting and by doing the progesterone shots. So I think that's all you can do. And I know just personally from taking care of patients who have been in your situation and had preterm deliveries, and then they kind of manage the second pregnancy different, and they go on to have term babies and it's completely fine. So that is my hope for you that happens. Yeah.
Me too.
Yeah. Yeah. All right, cool. Well, thank you so much, Jasmine. Can you just quickly remind listeners or tell listeners if they want to follow you, if you're on social media or you have a website or anything, you can share all of your stuff if people want to follow along.
Of course, yeah. So I have 2 social media accounts. So initially, before I had my son, when I was just not focused on having children, I started my
Yeah.
own business.
Yeah. Cool.
It's called Hills Everywhere Hair Care, and we sell natural hair care products.
Cool.
And it's on Etsy. If you just Google Hills Everywhere Hair Care, our Instagram name for that account is Hills Everywhere Hair Care LLC.
Cool.
Actually, we're gonna be starting to make baby products in the summer, organic baby products. So
Ooh.
that's something I'm excited about.
Yeah,
And then,
awesome.
yeah, and then our other Instagram account, because I had a baby born so prematurely, I like to raise awareness about
Mm-hmm.
prematurity, babies in the NICU and different things like that, and things mothers go through.
Yeah.
It's traumatic. It really is, and it's like you really do have stress from that, like anxiety. So I
Yes.
have another page for that, and my husband actually makes little onesies with cute little sayings on it.
Aw.
We call that account, it's called Miggy's World Creations, because his
Uh-huh.
name is Miguel. So
Cool.
Miggy for short. And
Miggy's.
that is, I think the Instagram is just Miggy's World Creations. And the same, we sell it on Etsy too. So check us out there.
Awesome. Awesome. Well, I'll link both of those in the show notes too for people to check you out and follow along if they want to follow you.
Great. Thank you so
Awesome.
much.
Yeah, thank you so much. Are you looking for birth education? Did you know that I have 2 fabulous birth courses that are super affordable? Well, I do. Head over to mommylabornurse.com/podcast to take a short quiz to see which birth class is for you. When you purchase either birth course, you'll have full access to it forever. And that means it will never expire and you can access it throughout any stage of your pregnancy or for any subsequent pregnancies that you have. You'll also gain free access to my Facebook group, linked to the class where you can ask questions about your pregnancy, share your birth story after you give birth, read other people's birth stories, and get to know other members who are in the course. There is also a money-back guarantee, so if you are at all unsatisfied with your purchase, please send me an email at hello@mommylabornurse.com for a full refund. There's really no risk to signing up, and I promise you will learn a ton about what's to come when you give birth. As a listener of this podcast, you automatically get 20% off any purchase if you use the code PODCASTLISTENER. I've had tons of moms just like you enter these birth courses and have fabulous, wonderful, empowering births because they feel so much more educated about what's to happen. So if you are at all curious about birth education, again, I encourage you to go to mommylabornurse.com/podcast and use the code PODCASTLISTENER to save 20%. All right, so that is it for this episode of the Mommy Labor Nurse podcast. You probably follow me on Instagram because that's probably where you came from. But if you don't, head over to Instagram and follow me at mommy.labornurse for more. That is certainly where I am most active. I also now have a separate Instagram for just this podcast, so I encourage you to follow my second account at mommylabornurse.podcast as well if you want podcast updates. Again, that is at mommylabornurse.podcast. As always, you guys know that I also have a website where I have tons of articles all about pregnancy, birth, breastfeeding, newborn stuff, and more at www.mommylabornurse.com. I want to hear more from you on how much you love this episode of the podcast or how you think I can improve. So leave me a comment on one of my pictures, send me a DM, or send me an email with all the love. All right, guys, I will see you same time, same place next week.